journey began 10 years ago in 2015. And at that time, there was several board discussions around the table at Calvary Hospital on the increasing number of residents that were leaving Calvary because we couldn't cater for the high needs dementia patients. And this was upsetting and unsettling for family, residents themselves, and for staff. The numbers that were given were that by 2050, there's going to be 3 times the number of people with dementia in New Zealand. So it was something that wasn't going to go away. It was at this time that Margaret Brown, the general manager at Calvary, went away and done a lot of research into dementia, and in particular dementia care. And she came back to the board with an option to building a dementia care village based on the De Hogeweyk model out of the Netherlands.
I am Eloy van Houw, and I'm one of the founders of The Hogeweyk in the Netherlands. The Hogeweyk is now known as the world's first dementia village, but more important, we try to move away from the medical clinical model to a much more social model, human model, holistic model of care. And that's what you can see here. So talking about life instead of talking only about your care needs and clinical care.
My name's Luke McSorley and I'm a Technical Principal Planning at WSP in Invercargill. Hawthorndale Care Village has been developed on a large 2.6 hectare site in Invercargill in the suburb of Hawthorndale. The site was previously occupied by a primary school, which was closed as part of central government changes in 2005. Unfortunately, the site then sat vacant and neglected for over 15 years until the Trust proposed their new development.
There was an incredible amount of fundraising that we had to go through to make this possible, and we couldn't have done it without the generosity of the Southland people. And it also gives us an opportunity to thank the likes of WSP and the contractors and the project managers who effectively brought a vision to a reality, brought drawings on a plan to this world-class facility we have down here in Invercargill now. WSP provided expert advice to us in the resource consent process, particularly around identifying the benefits of early and effective engagement with the local community. Allowed us to identify any concerns early and ultimately come up with solutions early in the piece rather than later down the track when they can be much more problematic.
We always encourage and say, please do not copy what you see at the Hogeweyk, but learn from the principles. The principle is the same. It's a house and it's designed like a house with a front door, an entrance, a kitchen, a living room and bedrooms. And that sounds very normal, but it's still not the norm in how we design for people with dementia. So it's adapted to New Zealand, this neighborhood with almost 1 kilometer in walking paths and many plants and nature and possibilities. That is already fantastic to see. There's a town center where you can go to for coffee or to the chapel or to the movies. So there's also reasons to leave your house, your beautiful house, and go somewhere else and meet other people. So that are very important principles in how you can design a good village. So it will have a huge impact also in how we in New Zealand think about people living with dementia.
There's 3 things in particular I'd like to mention which they brought to the table and were highlighted is, I guess, the opportunity that this project presented in terms of urban renewal of a vacant piece of land in Invercargill City. The other one was the positive social effects of the proposal. And finally, the positive health and well-being aspects of the care village and the benefits of the De Hogeweyk model. Getting that resource consent was a key milestone in our journey to building this care village. It's one of many milestones and a very important one.
WSP is very proud to have assisted the Trust with the resource consent application process. As a local community member, it has also been personally very rewarding to have had professional involvement in the project. Visiting the site now that it is completed, it's great to see what the Trust has been able to achieve in terms of a brick and mortar development, but more importantly, it's their achievements in advancing healthcare for people with dementia that is most impressive.
Every time I walk in the door, I'm just takes my breath away of what we've actually achieved. And you look around and you go, why isn't every rest home like this? It's how how it should be. But for us, success will be when this type of village becomes the norm for rest home care in New Zealand and throughout the world. We believe that our parents and our grandparents and our loved ones deserved care like we hope to provide here at the Hawthorndale Care Village.